Thanks to all the delegates who came to these breakaway sessions. And this afternoon, I'm going to be sharing with you a model called Creating Circles of Care, which emanates from the original Isibindi program. And it's a community-based program. And I've got my PowerPoint presentation up. And if you are able to follow, I'll just take you through. Due to time limitations, we may not be able to go through the presentation in much details, but I will try my best to give you as much as I can. So as we all know that the National Association of Child and Youth Care Workers, NACCW, has been around now for over 46 years. And the vision of the organization is to secure a healthy child and youth development and improve standard of care for vulnerable children. And the mission is to provide the professional training and infrastructure to promote healthy child and youth development and improve standards of protection, care and treatment for orphaned, vulnerable and at-risk children and youth in family, community, educational and residential group care settings. And just to look at the few strategic goals of the NACCW, which are developing and replicating models. And this is one of the models that I am going to be speaking about. The skills development, which include training of child and youth care work, consultancy and mentoring, professionalizing the field membership. NACCW is an association. We are a membership-based organization. Knowledge development and dissemination, international liaison. We had this morning some of the people from our networks internationally doing a message of welcome. And we are also doing advocacy for child and youth care. That is why we had all the people who came this morning and they spoke of the different challenges faced by child and youth care workers and calling on government and others to come in and assist in addressing our challenges. And so NACCW went into a partnership with aware.org and the Department of Social Development, as well as Innovation Age. Aware.org is a funding organization that some of you who may know a little bit about it. They get their funding, their proceeds from companies who are selling alcohol, and they approached NACCW through the Department of Social Development, through the Office of the Minister, to say they would want to do good in communities, especially during the times of lockdown last year. And we then spoke to Innovation Age, who were also interested, indicating that they would like to work together, bring in some funding, merge it with AWARE, so that we can be able to also focus on young children, in particular the ECD-aged children. So we partnered with AWARE and BSD with the aim of developing a community-based program with child and youth care workers as a response to orphaned and vulnerable children and their families during COVID-19. This was a 6-month program, but we are presenting it because there was a lot that we gained from it. Innovation Age supported the implementation cost for focus on assisting children 0 to 6 years old. As the adults and the teenagers were suffering, we also understood that the little ones were also suffering and they needed an intervention. So the program started in February. If I remember well, it was on the 22nd of February and ended end of July. And as I indicated, Innovation Age also was on for 6 months. The program goals were to provide child and youth care services to children and youth in their homes and virtually, and as well as virtually, by 137 child and youth care workers and 13 mentors. So we deployed these 150 child and youth care workers in total into 6 communities. In 6 provinces, which were Limpopo, Gauteng, KZN, Eastern Cape, Free State, and Northern Cape. And in addition to the goals, they had to improve child and family well-being with respect to their safety, education, health, and psychosocial needs, to include a family strengthening approach, cross-cutting all activities to ensure holistic support to each child and family as a whole, and to assess and respond to substance abuse, child protection, and gender-based violence, and non-center-based early childhood development. The area of substance abuse was the most supported by AWARE, because they wanted the child and youth care workers to educate communities on the overuse of alcohol and the binge drinking and women who are pregnant and drinking. So they wanted child and youth care workers to educate the communities on that. But we find that the child and youth care workers in communities did beyond that. As you know, when child and youth come into a community, they become a resource, and they are regarded as a solution to all the problems that are experienced in the community. So this is the model overview that we had. If you look at it, it shows that we have lined out some outcomes, special focus programs, direct service referrals, and virtual connection. So with the outcomes, the aim was to reduce substance abuse or substance usage by the communities over drinking, to improve awareness and adherence to COVID-19 safety precautions, because that was very, very critical at that time. People had to be educated about the washing of hands, ensuring that there is social distance, and the sanitizing and the wearing of masks, and not just wearing of masks, but the correct way of wearing masks. Reduced child abuse. We had and learned of many child abuse cases that were identified during the time, including some gender-based violence that even the president spoke about and mentioned it as a second pandemic in our country, second to COVID. They improved food security, where families they did not have enough food, and there was a need for an intervention to provide food parcels. They improved economic situations, where we find child and youth care workers even starting to teach communities, families and communities to plant their own grow their own vegetables and start their own food gardens, where some of them are still feeding from the gardens and some have turned that into some small businesses. And special focus programs included the programs on substance abuse, the substance use, and then early childhood development programs, the child protection, and so it was those three in the main, and the direct services. Referrals included COVID-19 education and awareness done by child and youth care workers. They were actually trained in that. They were trained to provide education on COVID-19. The child protection and GBV support services, where we intervened in families and educated families and assisted them to report the gender-based violence cases, and got other service professionals like psychologists and social workers and the community leadership to intervene. The food parcels, I've spoken about that, and the household economic services, I have spoken about that. So those were some, but we also added in as a strong component of virtual connection, where the child and youth care workers connected with families, children and youth on phone calls. They would send messages, SMSs, WhatsApps, and they created some chat groups where information was provided. So that was the model that we had, and it was a home visiting program with a virtual connection in it. It was a family strengthening program, which we believe it has been very successful. And if you want, you can even look at it as a district development model that was mentioned by the minister this morning. So, and then the program coverage, I indicated that we were in the Eastern Cape, where we had 7 children, as we're working in 7 communities in 3 districts, and we had 8 child and youth care workers. In the Free State, we're working in 11 communities, 2 districts, and we had 22 child and youth care workers. Gauteng, 11 in 11 communities, 2 districts, and the number of child and youth care workers there, we had 37. KwaZulu-Natal, 33, and in 33 communities. A number of districts were in 6 districts, and we had 50 child and youth care workers. In Limpopo, we had 21, we were working in 21 communities, 2 districts, and the number of child and youth care workers, we had 19. And the Northern Cape, we only had 1 child and youth care worker, who of course would have worked in 1 district and 1 community. So those are the numbers. We worked in 84 villages and in 16 districts, and we had 137 child and youth care workers. So when I talk of the district development model, one sees the way this program was planned and the child and youth care workers deployed. It very much meets the expectation of a district development model. And then the next point, there was the district development model that I was talking about. Because I have already mentioned that, I will not spend too much time on that. Just to say that this program worked as a part of an integrated district-based approach, which addressed a number of challenges. And we also worked with other partners like DSD, schools, Department of Education, Department of Health, and the local clinics and the local organizations. So, and then going to the next point, this is the program reach. We, within these six months, and if you want, you can even say that 5 months, because the last month was a wrap-up month, we worked with 33,515 children, youth, and adults who were reached between February and June. And 7,448 households, that is, and then 20,313 of all the people served are children and youth. So when one looks at how far reaching a program like this could achieve, it's actually excellent. We had an average of 200 beneficiaries per child and youth care worker, and 55 households per child and youth care worker. That is 4 to 5 people per family on average. And say the number of average beneficiaries were 25,000 per month who were reached. So, and these were same beneficiaries who were receiving services every month. So that is the program reach of this program. Okay, and then when one looks at the beneficiary profile as disaggregated, it shows the number of people who were reached in terms of their ages. We reached over 6,000 children aged between 0 to 6, and these are those that were supported by innovation age funding. And 3,000, almost 4,000 were 7 to 10 years old, 11 to 14 were just over 4,000, 15 to 17 were almost 2,500, and 18 to 24 were 3,584, 25 to 35 over 5,000, and 6,000 over 6,000 were 36 to 59-year-olds, and over 60 were 1,439. So those are the beneficiary profiles. The topmost services that were provided, the COVID-19 information shared, which was very critical at the time, psychosocial support, life space counseling, over 13,000, which is 41%. Homework assistance, 10,000, and it was really needed at the time because children stopped going to school and then they would go to school, like once or twice in a week. Family group conferences, intervening and supporting families, over 5,000, and ECD home stimulation support provided almost 5,000. So when you look at the referrals to Isibindi projects, to clinics and hospitals, social workers, SASA, Home Affairs, it shows the different statistics that we have there. And then referral services, COVID services, nutrition support, HIV counseling and testing, family planning, and other social services. So this, we believe that it's the program, it's in terms of cost, it is quite cost effective because we, in our calculations, is 211 rand per beneficiary with 33,515 total beneficiaries served. And we are talking of 38 rand per beneficiary per month and 349 per child with 20,000, over 20,000 children and youth, which gives us 63,000 per child per month. So per household, it's 951. It's even less than 1,000 rand that would be spent to provide services that changes a family in 1 month. So the program has got a potential for scale up, and we believe that going forward, it's a program that we are likely to see being rolled out in our country, of course, with the funding permitting. So I would like to thank you for listening, and I hope that you would have learned something and enjoyed the new program that NACCW came up with. Thank you. Vanessa, I'm not sure if there are any challenges. I am told that we have run out of time. So if there are any challenges, we can, any question, we can take one or two. Thank you. I can't hear.
Sorry. Thank you, Mr. Donald. We will just go into questions and answers if there are people that can ask some questions. Can you just give us a minute?
If we do not have any questions, Vanessa, maybe we can just conclude the presentation.
Donald, we do have here with me in the Eastern Cape, we have people who like to ask him questions.
Yes.
Yes. So I will just ask them to ask you a question.
Okay, thank you.
Okay, Mr. Donald, there will be no questions for now. We would like to thank you for this work that you guys have been doing, strengthening families, especially in the COVID-19 time, whereas you can't do face-to-face using the WhatsApp and the messages. I think that those were the platforms how to use strengthening the families so that they're not on their own in the difficult time. So thank you very much, Mr. Donald, for everything. Thank you.
Yes, thank you very much. I would like to thank Vanessa and also thank everybody who sat and listened to this presentation. What I have shared with you, it's very little compared to the amount of work that has gone out there and the success stories that we got from this program. And we, as indicated by the minister, as well as by Dr. Precious Pearl, child and youth care workers can do many when they get into the community. And we mustn't take our work for granted. We are making a huge difference in the lives of too many people. Sometimes you feel like you are touching on one child, but it goes beyond that, because if you can bring hope to one child, it might spread to the entire family and to the generations after that. So thank you very much. And I wish you well for the conference. Enjoy. Thank you.
Thank you so much.